Welcome back to the Cancer Cure Conspiracy. I'm your host, and this is episode 3, The Chemotherapy Cartel, Poison for Profit. In episode 1, we followed the money. In episode 2, we exposed the suppressed cures. Today, we go to the heart of the machine. We're going to talk about chemotherapy, the weapon they chose, the poison they sell, and the system they built to make sure you keep buying it. Every year, 1.9 million Americans are diagnosed with cancer. Every year, the cancer industry generates over $270 billion in revenue. And every year, the death toll remains catastrophically high. You have to ask yourself, after 50 years and trillions of dollars, why are we losing this war? The answer is simple, brutal, and documented. The war was never meant to be won. Let us start with the weapon they chose. Chemotherapy, the backbone of modern cancer treatment. The gold standard, they call it. But what is chemotherapy really? It is a derivative of mustard gas, the chemical weapon used in World War I to kill soldiers in the trenches. After the war, scientists noticed that soldiers exposed to mustard gas had reduced white blood cell counts. Someone, somewhere, decided that this property might be useful against cancer. And so the chemotherapy era was born, not from a breakthrough in understanding cancer, not from a cure, but from a weapon of mass destruction, repurposed for profit. Here is the statistic they do not want you to see. A landmark study published in the journal Clinical Oncology in 2004 analyzed the contribution of chemotherapy to 5-year survival rates across 22 major adult cancers in the United States and Australia. The conclusion? Chemotherapy contributed to just 2.1% of 5-year survival rates in the United States. 2.1%. For that number, we are poisoning millions of people every single year. Let us talk about what chemotherapy actually does to the human body. It is by design a systemic poison. It cannot distinguish between cancer cells and healthy cells. It attacks everything. Your hair falls out because the chemo is killing your hair follicles. You vomit because it is destroying the lining of your stomach. Your immune system collapses because the chemo is killing your white blood cells, the very cells you need to fight the cancer. Chemotherapy does not strengthen your body's ability to fight cancer, it destroys it. And then it charges you $100,000 for the privilege. Now, let us follow the money. The average course of chemotherapy treatment in the United States costs between $10,000 and $200,000 per patient. Oncologists in the United States are among the very few physicians who are legally allowed to profit directly from the drugs they prescribe. This practice, known as buy and bill, allows oncologists to purchase chemotherapy drugs at wholesale prices and then bill insurance companies at a markup of 20 to 30%. This means that the more expensive the drug they prescribe and the more of it they prescribe, the more money they make. Let that sink in. Your doctor has a direct financial incentive to prescribe you the most expensive, most toxic treatment available, regardless of whether it will actually help you. The pharmaceutical companies that manufacture these drugs are not in the business of curing cancer. They are in the business of treating cancer. Permanently, indefinitely. A cured patient is a lost revenue stream. A chronically ill patient is a customer for life. Pfizer, Roche, Johnson & Johnson, Merck, Bristol Myers, Squibb, these are not healthcare companies. They are financial entities whose primary obligation is to their shareholders, and their shareholders demand growth, quarter after quarter, year after year. The only way to guarantee that growth is to ensure that the demand for their products never decreases. And the only way to ensure that demand never decreases is to ensure that cancer is never cured. Let us talk about the revolving door between the pharmaceutical industry and the regulatory agencies that are supposed to oversee them. The Food and Drug Administration is the gatekeeper of the American drug market, but who staffs the FDA? Who makes these decisions? Overwhelmingly, they are former pharmaceutical industry executives, and when they leave the FDA, where do they go? Back to the pharmaceutical industry with lucrative consulting contracts and board positions. Richard Pazdur spent decades at the FDA as the head of the Office of Oncology Products. He was known as the Cancer Czar. Scott Gottlieb, former FDA commissioner, joined the board of Pfizer within months of leaving his government post. These are not isolated incidents, they are the rule. Now let us talk about the statistical tricks they use to make chemotherapy look more effective than it is. When pharmaceutical companies conduct clinical trials for new cancer drugs, they use a metric called progression-free survival. This measures how long a patient lives before their cancer starts growing again. It does not measure whether the patient actually lives longer. A drug can receive FDA approval based on extending progression-free survival by just a few weeks, even if it does not extend overall survival by a single day. And yet these drugs are marketed as breakthroughs. They are sold for hundreds of thousands of dollars. And patients and their families are told that this is their best hope. The toxic legacy of chemotherapy is not just physical, it is financial. The average cancer patient in the United States spends $150,000 out of pocket on treatment. Studies show that cancer patients are 2.5 times more likely to declare bankruptcy than people without cancer. Medical debt is the leading cause of personal bankruptcy in the United States, and cancer is the leading driver of medical debt. The industry has created a system where getting sick can cost you everything you have ever worked for. Your home, your savings, your children's college fund, all of it gone. Let us talk about the immune system paradox. Your immune system is your body's most powerful weapon against cancer. It is constantly surveilling your body, identifying and destroying abnormal cells before they can become tumors. The reason cancer develops in the first place is often because the immune system has been overwhelmed or compromised. So what does chemotherapy do? It destroys your immune system. It wipes out the very defense mechanism that your body needs to fight the cancer. This is not a side effect. This is a fundamental design flaw. And yet the industry continues to prescribe it as the standard of care. The enforcers of this system are not just the pharmaceutical companies and the regulatory agencies. They are the oncologists, the hospital systems, the insurance companies, and the medical schools that train the next generation of doctors. Medical schools in the United States receive substantial funding from pharmaceutical companies. A typical medical student receives less than 25 hours of nutrition education over 4 years of training. They are not taught about the relationship between diet, inflammation, and cancer. They are not taught about the metabolic theory of cancer. They are taught to diagnose and prescribe, and the drugs they prescribe are the ones that generate the most profit. The National Cancer Institute has received over $160 billion in federal funding since the war on cancer was declared in 1971. $160 billion. And yet, the 5-year survival rate for most solid tumors has barely moved in 50 years. Where did all that money go? It went to research that was designed to produce patentable drugs. Research into natural compounds, dietary interventions, metabolic therapies, anything that cannot be patented and sold for a profit, receives a tiny fraction of the available funding. The system is not designed to find a cure. It is designed to find the next blockbuster drug. Let us talk about the metabolic theory of cancer. In 1931, the German biochemist Otto Warburg won the Nobel Prize in Physiology or Medicine for his discovery that cancer cells have a fundamentally different metabolism than healthy cells. Cancer cells, Warburg found, rely almost exclusively on glucose sugar for energy. They cannot efficiently use oxygen for energy the way healthy cells do. This is known as the Warburg effect. The implications of this discovery are profound. If cancer cells are dependent on glucose, then starving them of glucose through dietary interventions like the ketogenic diet or through drugs that block glucose metabolism could potentially be an effective treatment strategy. And indeed, there is a growing body of research suggesting exactly that. But this research receives almost no funding from the major cancer research institutions because you cannot patent a ketogenic diet, you cannot charge $100,000 for a glucose blocking protocol. There is no profit in it. The ketogenic diet is not the only metabolic intervention that has shown promise against cancer. Intermittent fasting, caloric restriction, and other dietary strategies have all shown anti-cancer effects in laboratory and clinical studies. The drug metformin, which is used to treat type 2 diabetes and costs just a few dollars a month, has shown significant anti-cancer properties in multiple studies. The antiparasitic drug fenbendazole, which costs less than $10 a month, has shown remarkable anti-cancer effects in both laboratory studies and anecdotal reports from patients. These are not fringe theories, they are documented in peer-reviewed scientific literature. But they will never receive the funding and attention they deserve because they cannot generate the kind of profits that the cancer industry requires. Let us talk about the pediatric cancer tragedy. Children with cancer are among the most heartbreaking victims of the chemotherapy cartel. The standard treatment for childhood leukemia is aggressive chemotherapy. These children are subjected to years of toxic treatment that can cause permanent damage to their developing brains, hearts, and reproductive systems. Many childhood cancer survivors grow up to face serious health consequences from the very treatment that was supposed to save them. And yet the industry continues to use the same toxic protocols decade after decade because changing the standard of care would require admitting that the current approach is inadequate. The global contrast is stark. In Germany, integrative oncology centers combine conventional treatment with metabolic therapies, immune-boosting protocols, and nutritional interventions. In Japan, the use of fermented soy products and green tea as cancer preventive agents is well established. In Cuba, researchers have developed a lung cancer vaccine that has shown remarkable results. But in the United States, these approaches are dismissed, marginalized, and in some cases actively suppressed. The lobbying machine that protects the chemotherapy cartel is one of the most powerful in Washington. The pharmaceutical industry spends more on lobbying than any other industry in the United States. In 2023, the industry spent nearly $294 million on federal lobbying alone. This money buys influence at every level of government. It ensures that drug prices remain unregulated. It ensures that Medicare cannot negotiate drug prices. It ensures that the FDA continues to approve drugs based on surrogate endpoints rather than actual survival benefits. The cancer charities are part of the problem, not the solution. The Susan G. Komen Foundation, the American Cancer Society, the Leukemia and Lymphoma Society, these organizations raise billions of dollars every year in the name of finding a cure for cancer. But where does that money go? A significant portion goes to administrative costs, executive salaries, and pharmaceutical research. The American Cancer Society has received hundreds of millions of dollars from pharmaceutical companies. It lobbies against drug price controls. It supports the very system that is profiting from cancer. These are not charities. They are marketing arms of the pharmaceutical industry. The screening trap is another mechanism through which the cancer industry generates profit. Mammograms, PSA tests, colonoscopies, these screening tools are marketed as life-saving interventions. But they also generate enormous amounts of what doctors call overdiagnosis, the detection of cancers that would never have caused harm if left untreated. Studies suggest that mammography leads to the overdiagnosis and overtreatment of breast cancer in as many as 30% of cases. These women undergo surgery, radiation, and chemotherapy for cancers that would never have threatened their lives. The industry profits. The patients suffer. The environmental silence is deafening. We know that environmental factors, industrial chemicals, pesticides, processed food, air pollution are major contributors to cancer rates. The United States has some of the highest cancer rates in the world. We also have some of the highest levels of industrial chemical exposure, pesticide use, and processed food consumption. But the cancer industry does not focus on prevention. It does not lobby for stricter environmental regulations. It does not advocate for cleaner food and water, because prevention does not generate profit. Treatment does. The Rockefeller connection is essential to understanding how we got here. In the early 20th century, John D. Rockefeller and his associates used their enormous wealth to reshape American medicine. They funded the Flexner Report of 1910, which led to the closure of most alternative medicine schools in the United States and the standardization of medical education around pharmaceutical-based treatment. They established the American Medical Association as the gatekeeper of medical legitimacy. They created a system in which the only acceptable treatments were those that could be manufactured and sold by the pharmaceutical industry. This was not an accident. It was a deliberate strategy to monopolize the healthcare market. There are courageous doctors who have spoken out against this system. Dr. Linus Pauling, the only person to win 2 unshared Nobel Prizes, spent the last decades of his life advocating for high-dose vitamin C as a cancer treatment. He was ridiculed and marginalized by the medical establishment. Dr. Nicholas Gonzalez developed a nutritional protocol for pancreatic cancer that showed remarkable results in clinical studies. He was dismissed and his work was suppressed. Dr. Stanislaw Brzezinski developed antineoplastin therapy, a non-toxic cancer treatment that showed promise in clinical trials. He was subjected to multiple FDA prosecutions and attempts to shut down his clinic. The pattern is always the same. A doctor develops a promising non-toxic treatment. The establishment attacks them, their work is buried, and the chemotherapy cartel continues unchallenged. The immunotherapy revolution is being hailed as the future of cancer treatment. And there is genuine promise in immunotherapy. The idea of using the body's own immune system to fight cancer is scientifically sound. But the way immunotherapy is being developed and deployed is following the same profit-driven model as chemotherapy. Immunotherapy drugs cost hundreds of thousands of dollars per year. They work in only a minority of patients. And the research into how to make them work better, through dietary interventions, metabolic support, and immune-boosting protocols, is being largely ignored because it would reduce the need for the expensive drugs. The placebo effect is more powerful than the industry wants you to know. Studies have shown that patients who believe they are receiving effective treatment have significantly better outcomes than those who do not. The power of the mind-body connection in cancer treatment is well documented but largely ignored by the mainstream medical establishment. Because you cannot patent hope, you cannot charge $100,000 for belief. The industry profits from despair, from the idea that cancer is a death sentence that can only be managed, never cured, and only with their products. The insanity of the current system is captured in a single statistic. In 2022, the FDA approved 37 new cancer drugs. The median cost of these drugs was $200,000 per year. The median improvement in overall survival was 2.4 months. 2.4 months for $200,000. This is what the cancer industry calls progress. This is what they call a breakthrough. And the mainstream media, funded by pharmaceutical advertising, reports it as such. Without question, without context, without shame. The integrative future is possible. There is a growing movement of oncologists, researchers, and patients who are demanding a different approach. Integrative oncology combines the best of conventional medicine with evidence-based natural therapies, nutritional interventions, and mind-body practices. Studies show that patients who receive integrative care alongside conventional treatment have better outcomes, fewer side effects, and higher quality of life. But integrative oncology receives a tiny fraction of the research funding that conventional chemotherapy receives. The fasting-mimicking diet developed by Dr. Walter Longo at the University of Southern California has shown remarkable promise in combination with chemotherapy. Studies suggest that fasting before and during chemotherapy can make the treatment more effective while reducing side effects. But this research is not being promoted by the major cancer centers because it reduces the need for supportive care drugs, the anti-nausea medications, the growth factors, the antibiotics that generate additional revenue for the industry. The oxygen factor is one of the most suppressed areas of cancer research. Hyperbaric oxygen therapy involves breathing pure oxygen in a pressurized chamber. Cancer cells, which rely on anaerobic metabolism, are highly sensitive to oxygen. Multiple studies have shown that hyperbaric oxygen therapy can enhance the effectiveness of conventional cancer treatment and may have direct anti-cancer effects. But it is not a pharmaceutical product. It cannot be patented. It cannot generate the kind of profit that the industry requires. And so it remains on the margins of cancer treatment, available only to those who know to seek it out. The information revolution is changing everything. For the first time in history, patients have access to the same scientific literature that their doctors do. They can read the studies, they can evaluate the evidence, they can make informed decisions about their own treatment, and they are doing so in growing numbers. Online communities of cancer patients and survivors are sharing information about alternative and integrative treatments. Whistleblower doctors are speaking out on podcasts and social media. The monopoly on medical knowledge is breaking down, and the industry is terrified. You have the power to say no. You have the right to refuse any treatment that you do not believe is in your best interest. You have the right to seek a second opinion. You have the right to explore alternative and integrative treatments. You have the right to make informed decisions about your own body. The cancer industry has spent decades convincing patients that they are helpless, that their only option is to submit to the standard of care and hope for the best. That is a lie. You are not helpless. You are a human being with agency, intelligence, and the right to fight for your own life on your own terms. The system is rigged. From the research funding to the clinical trials, from the FDA approval process to the oncologist's prescription pad, every step of the cancer treatment pathway has been designed to maximize profit. Taxpayer money funds the basic research. Pharmaceutical companies take that research and develop patented drugs. Hospitals mark up those drugs by hundreds of %. Insurance companies pass the costs on to patients. Patients go bankrupt, and the cycle continues. This is not healthcare, this is a wealth transfer machine, and it is operating at your expense. We must demand accountability. We must demand an end to the revolving door between the pharmaceutical industry and the regulatory agencies. We must demand full transparency in drug pricing. We must demand that the FDA approve drugs based on actual survival benefits, not surrogate endpoints. We must demand that the NCI fund research into non-patentable treatments. We must demand that oncologists be prohibited from profiting directly from the drugs they prescribe. These are not radical demands. They are the minimum requirements of a healthcare system that actually serves patients. Support independent media. The mainstream media will not tell you this story. They are sponsored by the same pharmaceutical companies that profit from cancer. The truth is being told by independent journalists, whistleblower doctors, and platforms like WordUp Media Network. Support us, share our content, subscribe to our channel, because the only way to break the stranglehold of the cancer industry is to break the information monopoly that protects it. The awakening is happening. Millions of people around the world are waking up to the truth about the cancer industry. They are asking the right questions. They are demanding better answers. They are refusing to accept a system that profits from their suffering. We are at a tipping point. The cancer industry knows it. That is why they are working so hard to suppress this information. But the truth cannot be suppressed forever. Share this video, send it to everyone you know, post it on every platform. The algorithm will try to bury it, the industry will try to discredit it. But if enough people see it, if enough people ask the right questions, if enough people demand change, then change will come. Lives are at stake. Not just your life, the lives of your parents, your children, your friends. Everyone is at risk. Everyone deserves to know the truth. The cure is not a pill. The cure is the truth. And the truth is this. The cancer industry is not in the business of curing cancer. It is in the business of treating cancer permanently, indefinitely, for profit, until we change that fundamental reality, until we demand a healthcare system that is actually designed to make people healthy. The suffering will continue, the bankruptcies will continue, the deaths will continue, and the profits will continue to flow. This is WordUp Media Network, Unfiltered, Unforgiving, Unapologetic. We bring you the stories that shape our world, exposing the unseen and questioning the accepted. Subscribe now, share this video, and join the movement to take back our health, our money, and our lives from the cancer cartel. The revolution starts now.